It's not growing pains. Listen to me. Parents, kids, young adults, middle-aged adults, all of you. If you have back pain, you gotta get it checked out by someone who knows what they're talking about. And I'm not talking about a surgeon. Relax. I saw a patient yesterday. He's had back pain since age 14, ever since a bad fall when he was skiing. Back then, his doctors told him it was growing pains. Growing pains. Really? Okay. Fast forward to age 20. He re-injured his back and his doctors finally ordered an MRI showing, guess what? Disc problems. Recommended treatment at that time, PT, Advil, and recommendations that he live with it. Thanks, doc. Fast forward to 7 years. Yesterday, he's had daily back pain every day since age 14. And he's been doing the best he can with the tools he has. He's maintained a healthy weight, he eats right, he doesn't smoke, and he stretches. I mean, he stretches all the time. All the time. He even has an inversion table, but the pain never goes away. Some mornings, he can't even bend far enough to touch his knees. Sometimes he can't even put his socks on. And the kicker, he's 27. If he does the wrong thing, his back goes out for days or weeks at a time. He gets numbness and tingling in his legs. It's not what a 27-year-old should expect from his back. Why has this completely healthy 27-year-old been living with these symptoms since age 14? Well, it's because no one, not one healthcare provider, ever gave him any helpful solutions. So what can he do? What could he have done along the way? What can you do if you've got back pain and you're getting the runaround from your healthcare providers? Well, stick around because I'm going to tell you. First off, you need a diagnosis. Growing pains is not a diagnosis. I don't know what that even is. Something my grandmom would have said. That's ridiculous. How do we get a diagnosis? It's pretty simple. First, we listen to the patient. Usually the patient's story gives us everything we need. His story definitely did. And then we examine our patient. You know how many times I hear that doctors never even touch their patients, not even once? Do you know that even a basic 1-minute examination can give you more answers than a $2,000 MRI? It's true. Like I said, his story did tell me what was wrong, and we confirmed it with another MRI, which showed me exactly what was going on. For the most part, his spine looks great. I mean, it should. He's 27. It should look great. But after looking at that MRI for about 10 seconds, I can guarantee with almost 100% accuracy that I know what he did to his back when he was 14. He injured his bottom disc, and it's been injured ever since this accident, the whole time. It's never healed and has been giving him trouble all these years. I've seen this story 1,000 times, and the story is always the same, just like this guy's. And yes, it's true that most people do experience back pain at some point in their life, and for the most part, it gets better on its own, but sometimes it doesn't. This guy's sure didn't. But guess what? We can help him, maybe even fix him. And I'm not talking about surgery either. He actually did see a surgeon, and thankfully they told him he doesn't need surgery. They didn't tell him what he could do, but at least they told him he didn't need surgery. So yesterday, I sat down with him and we looked at his MRI for about 20 minutes, and we talked for another 20 minutes, and I examined him. And I showed him what a normal disc looks like and what his disc looks like. And I told him about the simple things we could do to get him feeling better in the short term, like a steroid injection placed precisely in the back of the inflamed disc. But I also told him that steroids are a really bad long-term fix, especially for someone young like him. Steroids aren't good for the back. They're not good for any tissue, actually. And I even told him about a pretty cool procedure called Intracept that can deaden the nerves that send pain signals from the disc to the brain, which might help his pain. But I also told him that Intracept wouldn't do anything to help his discs to keep from degenerating further. And you know what the last thing I did was? I gave him some homework. I gave him this book, a book written about him, about his exact problem. It's called Heal Your Disc, End Your Pain. And it was written by this brilliant physician, Gregory Lutz, who devoted the majority of his career to solving the problem of chronic spinal disc issues. Unfortunately, he passed away in early 2024, but before he did, he wrote this fantastic book, which has been life-changing for me and for many of my patients. This book talks about using platelets from our own blood as a way of treating painful discs at the fundamental root of the problem. Believe it or not, instead of going in and trying to chop out and replace damaged discs with screws, rods, and implants, we can use our own cells to reduce inflammation, promote growth, and even kill those pesky bacteria that can move into these discs, causing chronic inflammation and pain. So he's going to do his homework, and we're going to talk again in a couple of weeks, and hopefully we can get him feeling better without surgery. If this story sounds familiar, whether it's your own back or your kid's back or your spouse's back, do something. Read this book. I left the link in the description below, and it's really, really well written. You can read it in a day or two, and then call us or go online to book an appointment so you can get the treatment you need and get back to living the life you deserve without low back pain. If you found this video helpful, please check us out online at www.elitespinejoint.com or click on the link below to schedule an appointment. Thanks a lot and have a great day.